Hello, my name is Andrea Manuela Sandu, student ID 315835. Today, I will present our group project on communication and interpersonal skills, focusing on Sylvia dementia journey. We will look at how communication breakdowns affected her care and how evidence-based strategy can improve outcomes for patients like Sylvia. Sylvia is an older adult living with dementia. She was supported by her family carer and nursing staff during a community visit, which eventually led to hospitalization. The problem comes when a rush handover overlooked at carer concerns. This led to Sylvia to feel isolated and unsupported. Our aims in this presentation is to analyze communication styles, teamwork, and to suggest practical improvements. Communication is more than just words. It includes tone, clarity, and nonverbal signals such as eye contact, facial expression, and posture. In Sylvia's case, nonverbal in Sylvia's case, verbal issue included of medical jargon which create confusion. Nonverbal gaps are also present. Sign of anxiety in Sylvia and her carer were missed. Theory help us understand this better. Argyll circle highlights the need to check, understanding, and close the feedback loop. The SMCR model show how stress and jargon acting as a noise in this message. The Mehrabian theory reminds us that tone and body language often carry more meaning than words. There were some positives. Maintaining eye contact help build initial trust between staff and family members. But there were also failures. A rush tone created anxiety, broke the feedback loop, and prevented effective communication. The alignment gap meant practice did not adapt to Sylvia's individual needs. The consequences was poor feedback, miscues, and reduced safety. Practical barriers include jargon, hearing, and cognitive impairment, career stress, and time pressure. Person-centered care means respecting preferences, maintaining clear communication, and providing emotional validation. In Sylvia's case, miscommunication delayed care planning and caused isolation. The solution lies in simple language, confirming emotion and validating feelings. This strategy encourages engagement and reduce suffering. Reflection shows reflection shows us that validation and checking understanding are essential to preserve dignity and safety in dementia care. The team caring for Sylvia, including nursing staff, social worker, and her GP, positive practice was evident in shared assessment notes, but they were not always used effectively. Negative practice include unclear roles at handover, which lead to duplication and delays. Team dynamics assembled the storming stage of group development, which with confusion about responsibilities. Greater role clarity will have stumbling process and improve response times. Miscommunication had a clear impact. Care decisions were delayed, admission risk increased, work was duplicated, and patient safety was reduced. Evidence-based improvements include using the SPIR handover tool, holding regular team briefings, defining role clarity, and adapting structured communication protocols. At present, the team is functioning in a storming stage. By implementing SPIR constantly, can minimize misperceptions and improve coordination. To improve practice, training is needed in active listening, conflict exclamation, and inclusive handover communication. Practical tools, including SPAR, brief written summaries for carers, and communication aids for nonverbal support. Reflective practice is always vital. Regular debriefs using Gibbs or Kolb's model help uncover learning and minimize conflict. Policy alignment is essential. Dignity and clarity and informed consent must guide every interaction. The expected outcomes is better engagement, fewer misunderstanding, and more person-centered decision. To conclude, the key themes are clear communication, a person-centered focus, and effective teamwork. The impact of these improvements is better trust, reduced conflict, and self-care delivery. Communication is not just a technical skills, it's fundamental professional value that defines safe and clarity practice in health and social care. Thank you for listening. I will happy to take any question.